Good day everyone. So now we are going to present our NCP. So this is based on a disease called postpartum hemorrhage. So what is postpartum hemorrhage? Postpartum hemorrhage is a significant blood loss after giving birth. It's a number one reason for maternal morbidity and maternal death around the world. It is more likely with a cesarean birth and it is most often happens after the placenta is delivered. But it can also happen later. Okay, so let's go back to our NCP. First is the assessment. The subjective cue says here na, Nurse, ayaw pa rin tumigil ng pagdudugo ko kahit na nakapanganak na ako as verbalized by the client. Despite having given birth, the client stated that her bleeding has not stopped. And for the objective, the patient manifests heavy bleeding, pale skin color, painful lower abdomen and back with a pain scale of 7 out of 10, and lack of muscular resistance. And the vital signs here show that the temperature of our client is 36.4 degrees Celsius, pulse rate is 107 beats per minute, respiratory rate is 24 beats per minute, and the blood pressure which is 90/65 millimeters of mercury. So the nursing diagnosis is risk for uterine atony related to hemorrhage as manifested by heavy bleeding, pale skin color, painful lower abdomen and back with a pain scale of 7 out of 10, loss of muscular resistance, and low blood pressure which is 90/65 millimeters of mercury. After the placenta is delivered, these contractions help compress the bleeding vessels in the area where the placenta was attached. If the uterus does not contract strongly enough, called uterine atony, these blood vessels bleed freely and hemorrhage occurs. This is the most common cause of postpartum hemorrhage. Okay, so for the outcome identification, after 8 hours of duty, the client will stop bleeding, the skin color will return to normal, and the pain in the abdomen and back will be lessened with a pain scale of 5 out of 10. The blood pressure of the client will also increase and normalize. So the remaining part of NCP will be discussed by Ms. Aika Choco.
Now, for the planning, we have short-term and long-term plan. For the short-term plan, after 8 hours of nursing intervention, the client will stop bleeding. The skin color will return to normal and the pain in the abdomen and back will be lessened with a pain scale of 5/10. The blood pressure of the client will also increase and be normalized. Now, for the long-term plan, after 7 days of nursing intervention, the client will have no bleeding at all. There will be also no paleness of the skin and no signs of pain in the lower abdomen and back. The client will then be able to regain its muscular resistance too and can perform everyday household chores. Now, for the nursing intervention, we have independent, dependent, and collaborative or interdependent nursing interventions. First, let us proceed to our independent nursing intervention. First is to massage the uterus gently to cause it contract. The rationale behind that is to help expel clots of blood, and it is also used to check the tone of the uterus and ensure that it is clamping down to prevent excessive bleeding. Second is to provide additional or maintain existing intravenous IV infusion of lactated ringer solution or normal saline solution. The rationale behind that is for immediate fluid replacement and to restore circulatory volume of acute blood loss and fluids. Next is to monitor amount of bleeding by weighing all pads frequently. The rationale behind that is to measure the amount of blood loss to the client. Last, for our independent nursing intervention is to monitor the vital signs frequently. The rationale behind that is that early recognition of possible adverse effects allows for prompt intervention. Now, For our dependent nursing intervention, administer uterotonic medication. For example, is oxytocin or prostaglandins, PRN or Prorenata as ordered. The rationale behind that is to increase uterine tone and lessen blood loss. Last but not the least is our collaborative or interdependent nursing intervention. Refer to physical therapies to launch uterine massage effectively. The rationale behind that is to help bring the uterus back into alignment through application of gentle, non-invasive external massage applied to the back, sacrum, gluteus, and the abdomen. Last is the evaluation. At the end of 8 hours duty, the client's bleeding stopped. The skin color returned into normal, and the pain in the abdomen and back are lessened with a pain scale of 4/10. The blood pressure of the client also increased and normalized at 100/70 mm mercury. The goal was met.
Hello everyone, I'm Hannah Bianca T. Compas, and I will discuss to you our drug study related to postpartum hemorrhage. So, the generic name is methylergometrin maleate, and it is under the brand name Metergine. So, the dose recommended for this drug is 0.2 milligrams every 2 to 4 hours, and it can be administered through intramuscular. So, Metergine is a semisynthetic ergot alkaloid used to control bleeding after childbirth. This medicine works by producing vasoconstriction to increase the strength, duration, and frequency of contraction and the stiffness of the uterus muscles. So, Metergine is an ergot alkaloid that produces vasoconstriction to increase the strength, frequency, and duration of contraction, as well as the stiffness of the uterus muscles, which prevents and controls bleeding after giving birth. So, Metergine is administered in the postpartum period to help deliver the placenta and to control bleeding and other uterine problems. So, basically, Metergine is administered during postpartum period or after childbirth to help deliver the placenta and to prevent and control bleeding after giving birth. So, this drug is contraindicated with person that has hypersensitivity, hypertension, preeclampsia, pregnancy, and breastfeeding. So, everything we take in our body has its side effects. So, the most common side effects of this drug are abdominal pain, headache and dizziness, high or low blood pressure, nausea, and vomiting. While the severe side effects of this drug are skin rash, swelling of the face and tongue, chest pain, diarrhea, increase in sweating, foul taste, leg cramps, and stuffy nose. So, if you experience these severe side effects, might as well consider visiting your doctor. So, as a nurse, it's part of our responsibility to frequently monitor the amount of bleeding and vital signs, assess the location of the uterus and the degree of contractility of the uterus, assess the pain and bleeding, health education to food, beverage warning, and other side effects that the drug might cause.
So this ends the presentation. Thank you for listening.